Thank you so much for joining us. I'm here with Adam Perold, who is the co-founder and CEO of Element Incorporated, and we are at DiaForum in Bryanston, Johannesburg. Adam, thank you so much for joining us.
Pleasure, thank you.
To start off with, one of the things that you said is Africa's population will double in our lifetime. That's quite a remarkable figure. And obviously what Element is doing, tell us a little bit about that and how that is going to help us with our future problems.
Oh, sure, absolutely. Well, thank you, Ashley. It's a pleasure to be here today. And just like you said, what our company really seeks to address is large populations and helping connect populations to the health services and banking services of their countries. We're at the Roche Diagnostics DiaForum today to talk about diagnostics. But some of the key questions are, as you say, in Africa the population's increasing significantly. But even today, outside of that growth, there are needs to do better in terms of linking people to diagnostic test results and then, of course, treating them. So what our company does is seek to sort of help support that. So we've built an AI platform for recognizing people biometrically through any smartphone. Sort of the way that works can be as simple as, say, facial recognition through software that can run on any mobile device, or palm authentication, together with our partners Global Good and others. We're building the world's first infant biometrics platform to really help link people to the health system down to the age of birth. And then that's not the whole answer, but it's a piece of the puzzle to help deliver better health care, to link people to the medical records, understand the context of their issues, to provide better services.
So obviously this plays a pivotal role in development in Africa.
Yeah, absolutely, yeah, and in many ways actually. What we seek to really do is help empower our partners, which could be, say, the health system, it could be hospitals and clinics. In terms of development in Africa, that's pretty broad. You have health systems, you have financial systems. We sort of try to help financial inclusion. You have civil systems, where countries are trying to distribute resources to the population. Helping make sure that the right people are getting those resources is important, and so we try to help all of that.
So the software is run off a tablet, correct?
Any mobile device,
okay.
Any phone or tablet. Yeah.
And with tablets, how does the infrastructure of telecommunications and the not having the availability to the internet restrict your software?
It doesn't actually. We really sort of, it's funny because when you think about modern technology, oftentimes you think about sort of people in, say, Silicon Valley isolating very high-end use cases. Something unique about our company is that we sort of brought the sort of best of these modern technologies and focused on contexts that, for example, there may not be connectivity when we're delivering a solution. Our platform can run fully offline, and we actually do this in a number of countries now. And so the context of, say, South Africa or any of the countries on this continent, let alone, say, Southeast Asia and others, are ones that we've really built for. And our platform can enroll a person offline, local to that device. That account can then be digitally synced to, say, the Ministry of Health or to other partners whenever that device regains connectivity at some point in the future, whether it sort of comes across a Wi-Fi network or gets some cellular signal. So you can have an asynchronous system of delivery that still provides linkages between the population and the systems. And then over the course of time, sort of these problems continue to improve. Yeah.
So in terms of Africa and healthcare, innovation is obviously playing an important role. Do you think enough is being done?
On innovation in healthcare in Africa? Oh, that's a great question. That's probably a bit broader than my scope. That's a very big question. And well, I think that as long as problems exist, not enough's being done. So certainly delivering health solutions to populations in Africa is an area, as we discussed today in the conference. There's a lot that needs to be solved, I think sort of part of on the innovation side, what we need to do is not just sort of pick off a single problem and solve it narrowly, but try to build foundations that the system can be built upon. And so foundations like identity systems, we hope can be part of that solution. And then also make sure that we're building systems for the lowest common denominator. The last mile in many contexts could be a majority of the population of a country. And so making sure that we're really keeping that in mind is important.
And looking at universal health care, how does your software assist that?
Oh, great, thanks for asking. Yeah. So, look, in terms of universal health care, health coverage, there's a lot involved in that. The idea of providing access to a whole population to health services is very important. Some of the key parts to that are both on sort of the service and products that are provided to people and how do you make them available. And then sort of just when it comes down to it, can you set up a national health insurance system to cover the population? You really need both. That's an area that we actually are very excited about from an element perspective because sort of what we seek to do is help support the delivery of services in a targeted way to the person. If we can help link a person to their medical record, then the health practitioner can have a better understanding of what they need and how to solve their issues. But then also on the financial side of this, which in many countries is almost sort of a starting point. Almost doesn't matter if you can solve a problem if you can't finance it. The health insurance side is one where we can help automate the system because we can link a person to their health insurance record. And that's not just important for dealing with areas like fraud, for example, which quite commonly actually are quite high, maybe 25-30% of all claims. And there's many different forms of fraud. But even in the absence of fraud, just making sure from a health insurance perspective that you're attributing the right patient event to their account to deal with stuff like deductibles and doing that correctly digitally is a key part of universal healthcare. So the role that we seek to sort of play, there's a lot of pieces to it, but we like to sort of help support the delivery of services to the right people and also help automate the health insurance side to try to make sure that the system is providing the right resources for people that need it and it functions well.